My name is Dr. Steve Lee. I went to medical school in Washington University in St. Louis, and then I went to graduate medical in Boston, and I spent a while there studying anesthesiology, and then I did my fellowship there as well at Beth Israel Deaconess Medical Center, which is part of the Harvard Medical School area. So that was really good. I learned a whole lot there. So I've been here since 2014. It's been good. We've grown. We do hardly any marketing, and most of my new patients are word of mouth. And so I like keeping up to date with all the newest technologies out there in order to help my patients with pain. I'd rather get them off narcotics or avoid narcotics altogether. And the only way to do that is by making sure that we can correctly diagnose our patients with whatever pain problems they have, and then correctly figuring it out and helping them overcome them. Luckily, over these past several years, I discovered a wonderful product that's made by Spinal Simplicity. It's called Minuteman. It's kind of an obscure reference to the Minutemen, I suppose, from Boston. However, more specifically, it was great because of the results that I've had with it. But I do remember when I was first learning about it, I was a little hesitant about it because it's one of the first procedures that a pain doctor would do in this special technique of coming in from the side of the patient instead of the back. When a pain doctor does all those procedures, we typically use needles, small little needles, but we approach all these areas from the back. And so this new technique from Spinal Simplicity allows me to avoid a lot of the back structures in deploying a special spacer to get rid of the collapsed area of the spine that's the problem. I tell my patients now that it's basically like putting in a really small lag screw. I don't know if a lot of handymen at their home, they might understand the whole lag screw concept of in order to put something heavy in drywall, it's a screw that has a little hinge in it. And so as you put this screw through the drywall, then once you've penetrated through the drywall, then the hinge comes out, and then that hinge then deploys, it's perpendicular to the drywall, and then you can screw it close, and then you have a nice fastened area. And in much the same way, Minuteman does a really good job fastening two spinal vertebral levels by fastening the spinous processes together as it creates increased space within the spinal canal. And that allows someone that has a tight, collapsed spinal canal to actually have room in there, so that spinal cord has room to breathe. And it even helps the little side areas where there's the little holes where the nerves come out of. And if those nerves are pinched because the diameter of those holes are smaller, a successful Minuteman allows that tight space to open up, to give those nerves just enough room to breathe again so that someone can feel like their back is like 10 years younger. So I have an interesting practice where I've already had the opportunity to perform what I feel is many Minuteman procedures. And I tell my patients I get greater than 92% success rate altogether. And if a patient tells me that they get relief when they sit down or lean forward, then the success rate is even higher than that, especially if they have a single level where they have what we call spinal stenosis. Now, if someone has more than one level of spinal stenosis, I think that is a little bit more difficult, but the home run cases, and a lot of people do have a single level where they have what we call moderate to severe spinal stenosis, or the collapse and the tightness of that area. And I'm able to bring this new technique to all those patients so that these patients don't necessarily have to have a big whack, a big cut, and a splaying open of their back muscles and rods and screws that were traditionally used in the past to do something called a laminectomy, to remove the bone that's squeezing on their spinal cord. So this is such a great, wonderful new technique to enable our patients to not have to lean over so much, but that they can stand up straighter for longer and walk further. And so this has worked so well that I'm rather passionate about it, in that I can help all these people avoid big back surgery. In fact, my nurse practitioner, she came to me and said, hey, my father is having some issues with his back. And so I have their permission to share this story. He was deemed a candidate for this procedure, and I've been thrilled to death that, whereas before he had to lean forward and he was having issues with his back and even his legs, after we were able to do this procedure very comfortably, he's back to normal. It's great. He's standing up straight, walking, and just thrilled. And so I have many of these stories of these successes, and that just makes me thrilled to death, because this is why I even went into pain management to begin with. It's having the possibility of fixing a problem as opposed to just putting a patch over something. That's just the best thing.